Benadryl is the most popular over-the-counter allergy medication in America. 30 million Americans take it regularly. It is also the active ingredient in Tylenol PM, ZzzQuil, and most store-brand sleep aids. A 2015 study at the University of Washington followed 3,434 adults over 65 for 7 years. Those who took anticholinergic drugs like Benadryl for more than 3 years had a 54% higher risk of developing dementia. Not a mild increase, more than double the baseline risk. Your doctor prescribes medications to protect your brain, but the pill you reach for every night to help you sleep, or every spring to stop your nose from running, may be doing the opposite, and it is sitting on your nightstand right now. I'm Dr. Harlan Whitaker, 38 years in neurology. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. It is 10 o'clock at night. You cannot sleep. Your mind is racing. You open the medicine cabinet and grab 2 pink tablets, Benadryl, or maybe it is the store brand, same thing, diphenhydramine. You have been taking it for sleep 3 or 4 nights a week for the past 2 years. It works. You feel drowsy in 20 minutes and you fall asleep. Your doctor knows you take it occasionally. Nobody has ever told you to stop. It is over the counter. It must be safe. Your grandchildren take the liquid version for allergies. How dangerous can it be? The answer for your 70-year-old brain is very dangerous, and the damage accumulates with every dose. I spent 38 years in neurology watching patients come in with memory complaints, foggy thinking, slow recall, confusion in the afternoon, lost words. Before I ever ordered a brain scan, I checked their medication list, and a staggering number of times, the culprit was sitting right there. Diphenhydramine. The myth I need to correct is that over-the-counter sleep aids are harmless for older adults. They are not. The FDA approves these drugs for occasional short-term use, not for nightly use over months or years. And the risk profile changes dramatically after 65 because of how your aging brain processes these chemicals. Here is what diphenhydramine does inside your brain. Your brain relies on a chemical messenger called acetylcholine to form memories, maintain attention, and process new information. Think of acetylcholine as the Wi-Fi signal in your brain. It connects different brain regions so they can communicate. Diphenhydramine blocks acetylcholine. It jams the Wi-Fi. In a young brain with a strong signal, blocking some of it causes drowsiness, but no lasting damage. The signal recovers when the drug wears off. In a brain over 65, the acetylcholine system is already weakened. You have fewer receptors. You produce less of the chemical. The Wi-Fi signal is already weaker. Now you take a drug that jams it further. The brain cells that depend on acetylcholine for communication start to malfunction. Short term, you get brain fog, confusion, and poor memory the next day. Long term, repeated blocking of this system appears to cause permanent structural changes. Brain imaging studies show that chronic anticholinergic users have less brain volume in the regions responsible for memory formation. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Irene. Irene was 74 years old, retired postal worker from Baltimore, Maryland. Irene started taking Benadryl for seasonal allergies at age 60. When she noticed it made her drowsy, she switched to taking it at bedtime as a sleep aid, 2 tablets every night for 14 years. At 72, Irene's son noticed she was becoming forgetful. She missed a dental appointment. She repeated a story 3 times at Thanksgiving dinner. She could not remember where she parked at the grocery store. Her son scheduled a neurology appointment. The neurologist ran cognitive testing. Irene scored 24 on the MoCA, borderline for mild cognitive impairment. The neurologist was about to order an amyloid PET scan when he asked about medications. Irene mentioned the Benadryl, every night for 14 years. The neurologist paused. He told Irene to stop the Benadryl under his supervision and switch to a non-anticholinergic alternative. He asked her to come back in 10 weeks. At 10 weeks, Irene retook the MoCA. She scored 28, a 4-point improvement. The neurologist told Irene's son that she likely did not have Alzheimer's disease. She had drug-induced cognitive impairment. 14 years of acetylcholine blockade had been slowly degrading her brain function, and much of it was reversible once the drug was stopped. Here is your first assessment. Check every medication in your home for these active ingredients. Diphenhydramine, which is in Benadryl, Tylenol PM, Advil PM, ZQuil, Sominex, and most store-brand allergy and sleep products. Doxylamine, which is in Unisom sleep tabs and NyQuil. Chlorpheniramine, which is in chlortrimeton and many combination cold products. If you find any of these and you take them more than twice a week, your brain is receiving regular anticholinergic hits. Write down each product, the active ingredient, and how often you take it. This list is essential for the next step. Here is your second assessment. Think back over the past year. Have you noticed any of these symptoms? Feeling foggy the morning after taking a sleep aid. Difficulty concentrating on tasks that used to be easy. Forgetting things you were told the same day. Struggling to find words in conversation. Feeling confused in the afternoon or evening. If you are experiencing any of these and you take an anticholinergic drug regularly, the drug must be considered as a possible cause before anyone diagnoses you with a cognitive disorder. Many patients sitting in neurologists' offices right now have medication-induced brain fog, not dementia. Things that increase the danger of anticholinergics after 65. First, stacking multiple anticholinergic drugs without realizing it. Benadryl at night plus an overactive bladder medication like oxybutynin during the day doubles the acetylcholine blockade. Second, kidney or liver decline. After 70, your body clears drugs more slowly. A dose that wears off in 6 hours for a 40-year-old may linger for 12 to 18 hours in a 75-year-old. The drug is still blocking acetylcholine when you wake up the next morning. Third, combining anticholinergics with alcohol. Both impair brain function. Together, they create a compounding effect. Fourth, taking them with other sedating drugs. Benzodiazepines like Ativan, opioid pain medications, and muscle relaxants all add to the sedation and cognitive impairment. Here is what works for allergies and sleep without blocking acetylcholine. First, for allergies, switch to cetirizine or loratadine. These second-generation antihistamines relieve allergy symptoms without crossing into the brain in significant amounts. They cost about $8 a month at any pharmacy. Second, for sleep, try magnesium glycinate, 200 to 400 milligrams, 1 hour before bed. Magnesium calms the nervous system by supporting GABA, a different calming pathway that does not block acetylcholine. Third, tart cherry juice, 1 cup in the evening. Tart cherries are a natural source of melatonin and have been shown to improve sleep quality in older adults. Fourth, sleep hygiene. Keep your bedroom cool at 65 to 68 degrees. Block all light. No screens for 1 hour before bed. Go to bed and wake up at the same time every day, including weekends. These habits improve sleep quality more than any pill. This is the Whitaker Benadryl-Brain protocol. Step 1. Check your medicine cabinet tonight. Identify every product containing diphenhydramine, doxylamine, or chlorpheniramine. Do not stop prescription medications without your doctor's guidance, but over-the-counter products can be replaced immediately. Step 2. Replace your sleep aid with magnesium glycinate, 200 milligrams at bedtime. Give it 2 weeks to build effectiveness. The first few nights without Benadryl may be harder. That is the drug leaving your system, not evidence that you need it. Step 3. Ask your doctor to check your anticholinergic burden at your next visit. Ask specifically, are any of my prescription medications anticholinergic, and is there an alternative? Irene replaced Benadryl with magnesium glycinate and a strict sleep hygiene routine. The first week was rough. She slept poorly for 3 nights. By week 2, she was sleeping 6 to 7 hours without any medication. By month 3, her son noticed she was sharper. She stopped repeating stories. She remembered appointments without reminders. At her 6-month follow-up, her MoCA was 29, 1 point from perfect. 14 years of brain fog cleared in 6 months. Irene told her son she was furious that nobody had warned her. She asked me to tell everyone I could. That is what I am doing right now. Write your age below and tell me, is there a bottle of Benadryl or Tylenol PM in your medicine cabinet right now? I read every comment. Here are your 5 takeaways. 1. Benadryl and similar drugs block the brain chemical your memory depends on. 2. Regular use for more than 3 years increases dementia risk by 54%. 3. Switch allergies to cetirizine or loratadine today. 4. Switch sleep aids to magnesium glycinate 200 milligrams. 5. Ask your doctor to review all your medications for anticholinergic effects. Not every memory problem is Alzheimer. Sometimes it is the pink pill on your nightstand. I don't sell supplements. I don't run a memory clinic. I profit from you not needing me. Protect what you have. I'll see you in the next one.